The National Institute of Communicable Diseases, the NICD, has warned that the measles outbreak is spreading fast. It's now in 5 provinces with at least 406 confirmed cases. The NICD, along with the Health Department, first confirmed a measles outbreak after around 200 cases were recorded in December. Now let's discuss this. We are now joined via Zoom by Christine Mohigana, UNICEF South Africa's representative. Thank you so much for your time this afternoon, ma'am. Perhaps tell us specifically where these outbreaks are currently being seen, and are health institutions like clinics and hospitals on high alert at the moment?
So the outbreak started in Limpopo, and we now have cases in Gauteng as well. Actually, in the first weeks of this year, an increasing and concerning number of cases in Gauteng, in the 2-kilometer radius of Ekurhuleni. So health centers, hospitals are on the alert. A supplemental immunization activities campaign is planned for the beginning of February. And we, as I was saying, we are on the alert. The Department of Health and the health system in the country is on the alert, and we are reaching out to caregivers, to parents, to make sure that their children are vaccinated.
Now, what impact, can measles have on a child? I'm specifically asking this question because we know that the outbreak happened during a time where the schools were closed. Now that schools have reopened, just talk to us about what you are seeing and what impact this has on children.
So measles is a very infectious disease, and it can be fatal, particularly on younger children. So it's very important, as you said, as schools are reopening, that we prevent the further spread of the epidemic. And school teachers, parents, caregivers should have a sense of what the symptoms are and refer those cases immediately to health centers when they see them. We've been supporting the Department of Health. We're working through campaigns, social media campaigns, media campaigns. We have a media truck out that spreads the information on, how you are able to detect what measles looks like, so that we prevent the further spread. In schools, when children show the symptoms of measles, teachers and those who work in the school health system should immediately refer those cases so that we can, stop the spread of the epidemic.
Yeah, we know that in previous years, around 2009, right up until 2011, there were more than 20,000, outbreaks at the time. People with measles at the time. So we know at this stage, or do we know at this stage, if that 406 number is likely to increase? And also then what then needs to happen to make sure that it doesn't reach those levels that we saw between 2009 and 2011?
Yes, unfortunately, if we do not contain the spread of the virus, there is a potential that we get more cases than the 406 that we have so far. I do hope that with everything that we're doing and all the actions and resources that the National Department of Health is putting in place responses to the epidemic, we will not see a further spread. But it's urgent that action is taken, but also very urgent that parents check on the immunization status of their children, and that when they see signs of the possible infection of children or of adults themselves, they do refer to health centers, to clinics, to hospitals, so that we can make sure that the spread is contained.
You know, there are a lot of parents who don't know some of these symptoms that we are discussing today. So what are the first steps in terms of just isolating those children, particularly because you have a household with more children? You know, we know that, of course, that there's like more than 80% of children, really speaking, in South Africa that have been vaccinated, which is good news. But in cases, you know, where parents are having more than, you know, one or two children, how do they quickly isolate them and take them to a nearby clinic? What steps should they follow immediately when they see some signs?
So, I mean, referring to a clinic is a first step to make sure that not only the spread is contained, but also the child is taken care of. There is no cure really for the virus or the disease. That we just need to make sure that the symptoms are addressed. The fever, the rash, the sneezing, the runny nose, and making sure that there is proper hygiene around the child or the individual who's infected. You were saying that the good news is that we actually have good immunization coverage in South Africa. It is true in some areas, but we do have suboptimal immunization coverage in the country. It oscillates between 70 and 85%. It should be up to 95%. So that's what the National Department of Health is working on, making sure that the immunization coverage is high enough to really make sure that there is immunity in the communities. And something I wanted to underline is that unfortunately we do have in this country also close to 100,000 children who have never been immunized at all. So we're working on making sure that those are reached as well, because they're obviously most at risk of contamination and becoming ill.
What is the concern from an international perspective? I mean, what are you doing? We saw, of course, health authorities work very closely with other countries in terms of preventing this to move further out of the country. But what is being done? What are the conversations that you are having? I mean, a lot of people are asking the question, how did we even get here as South Africa? But we know, of course, that there are ways in which we can prevent this from spreading even outside of our country. Right.
So whenever there are cases such as these, there is surveillance systems that are in place. The information is monitored by our colleagues from the World Health Organization. So the information from for the sub-region, for example, is monitored by WHO. And if, for example, cases are detected at in border communities, in border areas, that information is closely monitored as well. And there are countries where the supplemental immunization activities that take place can actually be done simultaneously on both sides of a given border, so that the immunization coverage and the immunity is there on both sides, that there is no risk of cross-contamination. Fortunately, this is not the case here in South Africa, hopefully yet. As I was saying, the main reason for the outbreaks is suboptimal immunization coverages, the fact that there were disruptions caused by the COVID-19 pandemic, and perhaps also some of the misinformation and disinformation that's going on about the importance of immunization. It's really key that caregivers, parents know how important it is for children to be immunized. Parents need to know whether their children have had, the shots that they need to have against measles, and to make sure that the signs, the symptoms of measles are known, so that any cases are quickly referred to a hospital or a health center.
Christine, thank you so much for your time this afternoon. Really do appreciate all that information. Of course, that is Christine Mohigana, UNICEF South Africa's representative.